Hi, I'm Patrick Dunnican. At Gibbons, we believe that citizens need to be informed about the complex issues that affect their lives. That's why we're proud to support the programming produced by the CAUCUS Educational Corporation and their partners in public television.
Funding for this edition of State of Affairs with Steve Adubato has been provided by Gibbons PC, Hackensack Meridian Health, keep getting better, the New Jersey Education Association, New Jersey Institute of Technology, NJIT makes a difference in our students' futures. PSE&G, committed to providing safe, reliable energy now and in the future. NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. The TURRELL Fund, supporting REIMAGINEchildcare. And by Operating Engineers, Local 825. Promotional support provided by New Jersey Globe. And by Meadowlands Chamber, building connections, driving business growth.
Hi, I'm Steve Adubato. On September 22nd, I sat down for an in-depth one-on-one interview with Governor Phil Murphy. We talked about COVID. We talked about his relationship with President Trump. Talked about the millionaire's tax, a lot of issues. Soon after that interview with Governor Murphy, President Trump tested positive for COVID. You know the rest of it. We hope and pray the president and those around him get better and do well. Implications nationally, statewide, and internationally because of President Trump's diagnosis. So without further ado, taped on the 22nd of September, my one-on-one interview with Governor Phil Murphy. Hi, I'm Steve Adubato. Welcome to a very special program for the next half hour. We talk to the Honorable Governor of the great state of New Jersey, Phil Murphy. Governor, how you doing?
I'm doing well, Steve. Good to be back on with you.
It's good to be with you, and we'll be back in our studio at some point down the road, right close to where you are right now at the NJTV studio. But for right now, I want to ask you this question I've been thinking about for months in anticipation of this. I'm a student of leadership. I teach it, I coach it, and I make a lot of mistakes trying to be a leader. What would you say the number one leadership lesson you have learned about yourself and about leading in a global pandemic has been?
That's a great question. And you're good at teaching leadership, having seen you. I think, Steve, getting the balance right, and early on, I haven't talked about Churchill in a few months, but early on, I felt like this was particularly important to channel in some small way what he was doing early in World War II when the Germans had raced all over the continent, the Americans weren't in the war yet. Getting the balance between two things that seem at odds with each other. Number one, being direct and brutally honest with people, even when that news was really unpleasant, news that folks did not want to hear. And by the way, this continues to this day. We find ourselves, this lesson continues. So being brutally honest about what the odds are, what the facts are, but at the same time, giving a realistic path forward, giving hope, not just hope that is unfounded, but if we do this, the following can happen. And early on, you'll remember a lot of that was around crushing the curve, bringing that awful curve down. We have brought it down thanks to the millions and millions of folks in our state. But I think that's probably, if I were to say, what's the one thing I take from this, other than the enormous loss of life and the hundreds of phone calls and memorials that we've done, that's what I would say in terms of leadership.
I want to be fair to the governor and, frankly, more importantly, to our viewing audience. We're taping on the 22nd of September. This will be seen after that, and many times repeated in different venues. And so we're not going to try to be timely. If you want to check out the governor being timely, given a daily report, he does that every day. NJTV News with Brianna Venozzi and that team, they do an extraordinary job covering the governor day to day. But, Governor, I want to ask you this. If I know we're in the middle of this, and there's a long way to go. Has there been one, dare I use the term, I'm a golfer, a bad golfer, so I use the word mulligan. There's no joke here. A do-over. Something that you'd say, you know what, we didn't get that right. I wish I had another shot at that.
I think overwhelmingly, and I'm not alone in this, I suspect this is governors across the country. I would hope it's the president and his team, that we had known earlier the magnitude. If we had known even before the first case on March 4th, which is why my heart was heavy when I heard that perhaps the White House knew a lot more in early February. Getting that data, any amount of data that was reliable, we still are this way. I think that's the thing that if we had known earlier that it was in our midst, and remember, it was a greater New York City reality, so
that's right.
The northern counties got clobbered first, Bergen especially up front. I think that's the one thing that any of us would want to get a do-over on.
The nursing home situation, your perspective on the decisions that were made regarding people dealing with COVID, going back into nursing homes. Did you have the information that you wanted and needed to have at the time to make the best possible decision?
Well, as I say, early on, I don't think any of us had the information that we would have liked, and no part of our society paid a bigger price than long-term care. How would I assess the industry? Uneven at best, but we also have held up a mirror to ourselves. We brought in a nationally recognized firm to come in and do a complete soup to nuts. It's actually led to laws that I've signed as recently as last week. And we were very clear on one point you just made, Steve. We were crystal clear. Our Department of Health, led by our great commissioner, Judy Persicelli, has directive after directive that we never, ever, ever did or will support putting anybody who's COVID positive back into a non-COVID positive environment. If that was done, it was done completely against her directives. What we did say was you should separate your populations, cohort them, if you will. Different floors, different wings, different buildings, including Steve's staff members. Because one of the things that I think we found out early on, that the staff members were asymptomatic, even maybe in some cases loved ones coming in and out of the facilities unwittingly passing the virus on to somebody who was more susceptible. So when you separate patients, you got to separate staff as well. If long-term care facilities didn't do that, they did that directly against our directives.
Governor, on a personal level, if I can get a minute or so on this, you were coming off of, and I know you don't like to talk about this, and again, you can check out the governor on CNN, MSNBC, a whole range of other programs, but most of all, NJTV News. This is a different kind of conversation because I'm trying to have a bigger picture discussion, if you will, looking back, looking forward. Governor, you were coming into this, coming right out of surgery. And I know you don't talk about it, but you had surgery dealing with cancer. Was there any part of you that said, hey, wait a minute, I could use more time?
Yeah, probably. Honestly, I mean, the timing could not have been more challenging. I found out in late February that I had a malignant tumor, or a tumor that turned out to be malignant, and they thought it was, that I had to have operated on. So my surgery, Steve, was March 4th, and I came out of the recovery room into my hospital room. When I was able to pick up my phone and check it, the first text was from my team saying that we had our first COVID positive case literally that day, which is, when you think about that, we're now 200,000 plus cases later. I had hoped to take a week on my own and then a couple or 3 weeks sort of coming back half time. That playbook went out the window, but I just got a checkup, 6 months checkup. I've gained a few pounds. Other than that, I came through with flying colors, so I'm blessed. And I've paid nowhere near the price that so many families have paid in this state.
Governor, let's talk economics. Gyms, restaurants, a whole range of industries waiting on your word. You have this emergency order that continues, which gives you certain powers that you otherwise would not have. How much pressure did you feel when you were making those decisions about when indoor dining, when outdoor dining, when gyms could open, when they couldn't open, how many people, what's the percentage. How much of that decision-making process based on the science and safety, I don't want to say versus, but tied to the economics of this and so many people struggling and suffering and whose businesses, frankly, have gone out of business since then?
Listen, we have nothing but enormous empathy, sympathy, and support for the business community, especially the small business community. Gyms, theaters, restaurants, hospitality, completely obliterated. Having said that, we have and we continue to lean. That's not to say we're not prepared to take on some amount of manageable risk, because we have. But we have leaned from moment one toward a bias toward the science, the data, the facts. So but I haven't said it in a while, public health creates economic health. And so, yes, was there an enormous amount of passion and pressure? Absolutely, but we have tried to call balls and strikes every step of the way. I'm happy, finally, that gyms, restaurants, indoor entertainment, even with capacity restrictions, are finally, thank God, open. Schools back. We're slowly getting there, but the science and the data has to continue to dictate the steps we take. I want the economic recovery. Our EDA has put a ton of money out. We've used a bunch of federal money. We need a lot more, Steve, let there be no doubt about it. We need a lot more out of the feds to inject into our economy, and that's unfinished business right now.
Let's stay on this. By the way, we're going to be up against a break in about 2 minutes. The governor is going to stay with us for the full half hour. Check out our interview. Our website will be up, steveadubato.org. We did with Tim Sullivan of the Economic Development Authority, talking about those small business initiatives, trying to help those organizations, help those businesses. Governor, let me ask you this. You talked about federal help. I saw you on CNN as well as MSNBC and other places the day that the Woodward book came out, the day that we heard those transcripts from Bob Woodward speaking to President Trump, with the president telling Woodward how bad he knew it was and that it was airborne. It was 5 times, I believe he said, worse than a serious flu. Not what he said publicly, but you sat across from the president in the White House, very friendly. My sense is this: how much do you struggle, Governor, and this isn't a philosophical question, it's a practical one. How much do you struggle saying what you actually think about the President of the United States and his leadership and his performance in this versus the fact that you have to play the game with him in order to get the federal help that New Jersey needs, which is to often not say what you really think?
Yeah, I don't see it quite that way, Steve, and I don't think I pulled punches, and I was really angry when I heard that February 7 transcript.
And you said it publicly, Governor.
And I said it publicly. I don't agree with him on vote by mail. I've said that publicly.
We'll talk about that in a minute.
He and I, by the way, still speak regularly. He and I spoke last week on the telephone. The fact of the matter is, we have. Well, it was pleasant. It was pleasant. Here is the way I look at this. Job number one is to save as many lives as we can. And so we've been able, particularly when our fat was in the fire early on, when we were short ventilators, beds, PPE, testing capacity, we were able consistently to find common ground with the president and his administration, and I will be forever grateful for that. But by saying that doesn't mean that I can't also say that I still wish we had a national policy for this pandemic, that we had known what he knew on February 7th. And then other areas where we disagree, that we'll continue to talk to that. But if it means saving lives and finding common ground to do that, we have done that and we will continue to do that.
We're going to take a break. Excuse me, we come back. Talk a little bit more about the pandemic, including the mask issue and the fact that it has nothing to do with politics, blue state, red state, Democrat, Republican, like the president, don't like the president. As the governor said, it's about public safety, but I also want to talk about vote by mail in this election. And this is Steve Adubato. Way more importantly, that is Governor Phil Murphy. We'll be right back after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
Welcome back. Steve Adubato, speaking with the Honorable Phil Murphy, the governor of New Jersey. Governor, let me ask you this. Vote by mail. You made a very public statement, a pronouncement, an edict, if you will, that we needed to largely vote by mail because of public safety. Some others, including not just the president, but Senate President Steve Sweeney, recently told us he disagreed with that position, and he feels we have to do the best we can with that, but that more people should be able to vote in person. You've taken a hard line about this. Make the case.
Yeah, I mean, I respect the Senate President. We've had some really good conversations on this and a whole lot of other stuff lately, I have to say, a lot of good ones. So here's the thing. We're trying to balance, again, I mentioned earlier, balancing hard facts with hope. This is balancing public health with the sacred element of democracy, which is the right to vote. So we tried a hybrid model for the primary, and it overwhelmingly worked very well. We had some tweaks. We wanted to tighten it, and that's the model that we have put forward for the general election. And Steve, the way I think of it is this. Everybody's going to get a ballot in the mail. You have 4 choices. Fill it out and mail it back in. And we've been all over the Postal Service to make sure that they're going to be big and strong to make sure that gets in. And we've extended the amount of days by which it gets in to be counted. Secondly, fill it out and put it in a secure lockbox. We'll have several hundred of them around the state. Thirdly, fill it out, show up on election day and hand it to a poll worker. Or if you don't like any of that, show up and vote in person. Each county is going to be required to have at least 50% capacity. Each municipality, at least 1 physical location on election day. The only difference is it'd be a paper ballot, because that's the way that we make sure that you didn't do both vote by mail and in person. And we think that gets that balance right. Public health and the sacred right to vote.
Real quick on this. Those who have argued, hey, wait a minute, you got to wait in a motor vehicle line. You got to wait for hours sometimes. What's the difference? I'll wait to vote, you say? Yeah.
So listen, here's the thing. There are a number of functions and items of request with motor vehicles where you actually could do it online. And we're screaming every day, please go to their website and check to see if you can do it online. And if you can't do it online, and don't show up. Voting happens to be something that you can do it this way. My view is if public health is really important and we're trying to save every life we can, and we have an obvious, easy way to underpin our democracy to get people to vote and do it safely, let's do it. And that's what we're going to do.
Governor, do this for us. Hardcore on masks, no debate. You call people knuckleheads, appropriately so. Yeah, there it is. You got yours, I got mine right here. I promise you it's here, Governor. See, now I'm on the spot, but it is here.
I'll put you on the spot, Steve.
Tell people exactly what they need to do. It's not Democrat, not Republican, not blue, red, whatever. What should we be doing to protect ourselves and, more importantly, those around us?
Yeah, I mean, it's so and by the way, it's a great, thank you for putting it that way. We don't have a therapeutic yet. There's a lot in motion, which is great. We don't have a vaccine yet, but there's a lot of momentum there that sounds very encouraging. So until we either have something that treats it or prevents it, we're left with the basics. Social distancing, wearing a mask, washing hands with soap and water, staying home if you don't feel well, get tested. Basic stuff. But the good news is, because it's basic stuff, there's no reason why we can't all do it.
Yep.
And particularly, Steve, when we're inside. I can't say this strongly enough. And with the weather starting to get colder, the concern is rightfully that we'll spend a lot more of our lives inside than we have been spending over the course of a beautiful summer. Especially inside, social distancing, mask covering really, really makes a difference.
Give me 30 seconds on this. Do you care, Governor? Do you significantly care about being criticized by some who believe that you are overreaching, that you are overly cautious? And do you care about any of that? Or do you simply do what you believe is right in a public health crisis?
I don't care about it, and I don't want that to sound callous. We're trying to do what we think is right. That doesn't mean if someone has a responsible argument. I'll give you an example. I spoke to a hair salon the other day. She said, you know what's really hurting our business right now is you're not allowing walk-ins. And she said, I promise you, we would treat the walk-ins the way you would want us to. Temperature check, fill out the questionnaire, do all the stuff. And I went back to our team and I said, you know what? She had, I thought, a very reasonable argument. It turns out our concern is not that the health check wouldn't take place, but that you and I and 5 other guys would show up at the same time and would be congregating. So our team right now is trying to think through a way where you could both do the health checks, which they're confident you could do, and not have people standing on top of each other. She was responsible. It was a fair input. We've taken input like that all along. But in terms of doing the right thing versus caring about folks who don't see it that way, we're going to try every step of the way to do the right thing.
Governor, try this. We are doing a series of programs, interviews, segments, programs called Reimagine Childcare. It is was formerly known as Right from the Start NJ. We actually interviewed the First Lady on this subject recently as well. You have dedicated, help me on this, Governor Murphy commits $250 million to support child care services. This is coming from Tom Bergeron, the folks at ROI. My question is this: what exactly is the commitment to child care from your administration, and who will it help the most?
Yeah, I mean, $250 million of federal CARES Act money to child care. We can't find another state in the nation that's put that much to work. And so the 250 breaks down into a bunch of buckets, Steve, but the big ones are money to get daycare centers back open and on their feet, money to subsidize their operations because we're limiting capacity, and then the biggest chunk is money to families under a certain income level who otherwise could not afford childcare. And it's part of the notion that the hip bone is connected to the thigh bone here. You can't make a decision on schools or back to work or essential work and not have a viable, vibrant daycare plan as well. And I'm proud of the plan we put forward.
Got it. Governor, every time I've interviewed you, I've asked the same question, but it's the question's in a different context now. You've been talking about a millionaire's tax, a hike in taxes on those who earn between $1 million and $5 million. But now it's a reality. The Senate President just interviewed him. He's on board. The Assembly Speaker, Craig Coughlin, he's on board. It looks like you have the votes to get this done. I don't want to date this. It'll be seen after it's probably a reality. How much of that, Governor, getting it done, because you've been pushing it for years, is tied to the fact that there will be rebates that go to more middle-income families starting in the summer of 2021, and some of the money from the increase in the millionaire's tax will go to that? Do I have that correct?
Yeah, you do. And do I think that's a part of the reason why we got it done? Yes. But I have to say from the get-go, even when we were campaigning, and then when we first proposed it and got partial success, as you rightfully point out, $5 million and up have been paying this premium since our first budget. The notion was always in some form or fashion to drive a big chunk of that money into the middle class and into the dreams of those who aspire to get in there. So whether it's a rebate check, or it's more money for school funding, or more money for healthcare, or other middle class needs, that was always the notion, and I'm thrilled we were able to arrive at the solution. I want to give a big shout out to the Senate President and the Speaker, because they've had a great spirit of teamwork and common ground, and the formulation that we ultimately settled on, I think, is a really good one. And it's a really good one, most importantly, for New Jersey's middle class.
Governor, quick follow-up. John Bramnick, the Assembly Republican leader, and other Republicans have argued, you know what? We've lost so many people of wealth, millionaires. They move to Florida. They have one day more than half of the year. They become official residents of Florida. Now we lose all that income tax revenue. Are you concerned, or how concerned are you about that reality?
I consider John a good friend and a guy who I like a lot, but I disagree with him on this. I'm concerned about losing people from New Jersey, but it's not based on a millionaire's tax. The people that and the research shows this, and so we're focused like heck on this, but it's a different angle. The people we lose, Steve, are retirees overwhelmingly in the middle class, who have a fixed income, who own a home, whose kids have graduated from our #1 in the nation public schools 2 years running, and a big chunk of their property tax bill is for public education. And they say, wait a minute, we love this place, but this makes no sense to us. That's why homestead rebate, that's why property tax relief, that's why a check into a middle class family, why all of that matters and helps. Right now, New Jersey's growing. We're seeing people, we wish New York nothing but the very best of success, because we're, as New York City goes, the northern part of our state goes. Likewise for Philadelphia in the south. The fact of the matter is there's an undeniable trend from urban to suburban related to this pandemic. Whether it's permanent or not, I don't know. But the fact of the matter is we're growing as a state, and that includes people at all levels of income.
I want to remind folks that we are taping on the 22nd of September. It'll be seen after. Some of the things the governor has talked about in terms of policy decisions from his office, from the governor's office, things may change. And I'm not speaking for the governor, it's just a reality. And so I want to clarify that, be fair to the governor, but again, more importantly to our audience. Governor, let me just say this on behalf of all of us in public broadcasting who are producing remotely, as you well know. We thank you for being accessible. We thank you for being out there every day. Whether people agree or disagree is not the issue. It's having our public officials be out there accessible and open to all kinds of questions. Governor, we wish you and your family all the best, and thank you.
Thank you for having me, Steve. That means a lot.
All the best. I'm Steve Adubato. Thank you so much for watching this very special edition with Governor Phil Murphy. We'll see you next time.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by GIBBONS PC, Hackensack Meridian Health, the New Jersey Education Association, New Jersey Institute of Technology, PSE&G, NJM Insurance Group, the TURRELL Fund, supporting REIMAGINEChildcare, Operating Engineers, Local 825, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey. Promotional support provided by New Jersey Globe and by Meadowlands Chamber.
Hello, this is Bob Garrett, CEO of Hackensack Meridian Health. As we see a downward trend in COVID-19 patients, we must continue to take measures to promote good health with safety at the forefront. We've created designated areas for the treatment of COVID-19 patients. We're monitoring the temperature of all patients, visitors, and team members, and we're thoroughly cleaning and sanitizing all facilities. It is safe to come back and get the health care you need. Visit hackensackmeridianhealth.org/getcare now.